So hello again. I know it's late, so we'll be brief, but I do want to just put my doctor hat on and say that digital transformation isn't just something that's abstract. It's real, and it really helps us in our job. And so as a doctor or a nurse, what is digital transformation? It's just another tool. Technology to a doctor or nurse isn't good for technology itself. It's what can it do for me and for the patient. It's just like a stethoscope or a medical device. Digital transformation is a tool that helps us with patient care. And the more it allows me as a doctor to just get back to the job that I signed up for, which is to see patients and care for patients, the better it is for me. And so we have some experts with us today that have done digital transformation in many ways. And just like this morning in our workshop, when we shared the findings that you all did, they're going to share a few bullet points around the most important things that help them move their institutions from paper and slow digital to fast digital, and even now the cutting edge. So I'll introduce Dan first. Dan, you want to introduce yourself and tell them where you're from?
All right. Well, it's late, so we'll make this brief. But Dan Howard, I'm the CIO for San Ysidro Health. So just to give you a quick idea of who's all been to US before. Show of hands. I know some of you people, I recognize the faces. You guys have been to San Diego. So I'm going to just share, probably be 5-6 minutes. I'll be done. But a little bit about our journey. This really started about 5 years ago for San Ysidro Health. And it is a journey. It's not just you set it and forget it. It's a constant iterative process where you are going through and working with your stakeholders and operations to continually improve. And for us, it's really about embracing innovation with two things in mind: things around increasing the efficiency of the organization, and the second thing is enhancing that patient experience or that patient journey. Again, San Diego County, it's about 12,000 square kilometers. We have about 3.5 million individuals that live in San Diego County. And so we cover all that area. A little bit different than like Aaron. Our organization is entirely 100% ambulatory. So no acute care hospitals. All of our sites of care are across the county of San Diego. And we do primary care, dental, behavioral health, chiropractic, acupuncture, specialty care, same-day surgery, etc. So why it was inherent for us to be, it was an operational imperative for San Ysidro Health to do a digital transformation. If we went back 5 years, we had a bunch of disparate systems. We did not have what you call a unified KISS or electronic health record. And so it was really an operational imperative. A lot of healthcare in the United States, we are very revenue cycle driven and very closely tied. Our profitability is tied to how well we do documentation and do coding and things like that. And so it is very important for us to do a really good job in terms of delivering care, but documenting that care and making sure we dot all the I's, cross the T's from a revenue cycle standpoint. And so that's how we stay in business. Again, so the two things that we focused on was system consolidation, and then we used some very targeted AI use cases that were targeted for operation and clinical niches. So I wrote in here 6 bis 1. So we had 6 separate KISS solutions 5 years ago. And obviously, you can imagine all the challenges you have with sharing data between different medical disciplines that were on a different platform. And so a little over 2 years ago, we consolidated all of our clinical systems or KISSes onto one single platform. That was a huge benefit because now you have a single source of truth for all your patient data within your 4 walls where we're providing care. Streamlining things like care pathways for patients, and also leveraging the data there so providers really have the most up-to-date information when they're caring for that patient. We used some targeted use cases. Obviously, we wanted to do AI a little bit sooner, but we had to build our foundation first. And that was really about having a single source of truth for our patient data. And so we began a pilot for clinical ambient listening. And again, the goal around that was really around reducing the cognitive load for providers and clinicians when they're caring for that patient. So I know, I think in the US, we're a little ahead of you guys in terms of the ambient listening. But that has been a huge benefit. We've rolled it out to the entire organization. And what we're seeing after about 6 months is we were seeing saving providers anywhere between 40 to 60 minutes a day from that documentation burden. And ultimately, we're big on the mission of the organization. Our mission is really about improving the health and well-being of the communities we serve with providing great access. And so if we're able to do that, this solves a provider challenge in terms of giving them more time back to do those administrative tasks. From a financial operational perspective, it's great from the financial perspective because operations looks at, hey, perhaps we can see an additional patient. So it's also helpful for the patient because we can provide additional access, more appointments, et cetera. We did an AI fax automation solution. We about 60,000 electronic faxes a month. And historically, we had groups of individuals who would actually manage those faxes, have to look at the fax and figure out, is this a referral? Is this a fax for a medication prescription? Is this an authorization for a release of information to an insurance company? And so that took monumental amounts of hours, thousands and thousands of hours a month to handle that volume. And so we put an AI agent in place to handle that. So what happens now today is when those electronic faxes come in, the AI agents will scan those documents automatically and categorize them appropriately. And then we have an integration with Epic, and it'll actually put it directly into the chart where it needs to go. There are always things that will still fall out, that we do have a small team, but we have eliminated 12 FTEs from doing that labor. The cost for that is costing us $4 per agent per hour. And that's a lot less than we have to pay an individual to do that manually. And last one here is we see patients obviously throughout the year, but based on our FQ status, we're responsible for the quality of care. And we do annual wellness visits. And one of the things that we had a challenge with is for our diabetic cohorts, we had some really low quality numbers in terms of our annual screening for mild to moderate diabetic retinopathy, which is an eye disease that you can get. And if it gets out of hand, you'll lose your vision. And so our traditional workflow had been to the patients who come in for their annual wellness exam, and we'd have an ophthalmologist look at them. And if he wasn't exactly sure if they actually had that, they'd have to dilate their eyes and then wait, and then do the exam, look at the photos, and then determine, hey, do they have it? Maybe they do, maybe they don't. And then we would send them out to a specialist. We sort of took an AI solution and said, you know what, let's put some technology in front of that. And so now what happens is we actually have an AI solution that come in, and as part of that wellness exam, we have these cameras. The patient will sit there. It takes about 30 seconds. Within another 30 seconds, we'll have a result back from the AI that says, what is the susceptibility of that patient having mild to moderate diabetic retinopathy? If it is flagged as a potential positive, a referral automatically goes out. The appointment gets automatically scheduled with the patient. And we have cut down that lag time from probably several weeks down to a couple of days. And so that's great for patient safety. And last thing real quick is, I think Aaron said this the other day, AI doesn't always work. We get about 1.4 million calls a year into our call centers, and we had a big challenge with the ability to answer those calls. And so about 2 years ago, we put in conversational AI chatbots and voice conversations. So when our patients called, instead of just getting the IVR or intelligent voice response from your telephone system, they'd actually talk to a bot and have a conversation and ask questions. It worked really good for about 6 months until our patients got frustrated. and say, you know what, we don't want to talk to a robot. We don't want to talk to AI. We want to talk to a live person, even if they had to wait. And so we actually pulled that out, okay, because the customer didn't like it. And so that was a great lesson learned for us. But anyway, I appreciate your time. Thank you so much.
Thank you, Dan. Thanks very much, my friend. So next up, I believe we have Shane Thielman, Senior Vice President and CIO at Scripps Health out of San Diego, California. I know Shane is in a Zoom room. He's joining us from San Diego right now. Shane, can you hear us? We're having some technical issues. And we can't hear or see Shane either. So I will stall. That's what we will do. So one of the things I think it's very important for us to share here is that we are willing to share. So Dan just talked about some of the activities, the AI related initiatives at San Ysidro Health.